weekly segment about everything that worries us. This viewer is asking, should everyone be tested for gluten sensitivity or celiac disease? Are the tests reliable? I wonder if the concerns about gluten are overblown. Dr. Siegel.
Wow, that's a great question. And here's what I think the answer is. First of all, if you have abdominal pain out there, weight loss, fever, and even vomiting, I start to think about this as a possibility. But I'll tell you what the problem is. There's 3 million people out in the United States with something called celiac disease, Arthel. Celiac disease is easy for me to test for. It's antibodies against something called gluten. Gluten is in whole grains. It's 2 proteins in whole grains known as gliadin and glutenin. Your body will make antibodies to it and start to chew up your small intestine. If you have celiac disease, that's 3 million people. But there's 18 million people out there, 18 million, who think they have a gluten sensitivity, meaning they have some of these same symptoms, weight loss, fever, they're having diarrhea, they're not doing great. And I can't prove that they have gluten sensitivity because the tests aren't sensitive enough to pick it up. Sometimes they are, most of the time they're not. And I want to say one last thing. If I put you on a gluten-free diet, and everybody out there is going on a gluten-free diet, guess what I have to cut out? Something that me and David are talking about all the time on the show here, our Mediterranean diet, fruit, vegetables, and whole grains. Whole grains are good for your heart, so I don't want to exclude them, especially wheat, unless I have to.
But the people who feel that they are allergic to gluten, they go on a gluten-free diet. Does that work for them?
Well, if you look at the question that you asked, you said they feel like they have gluten-free. And it's very interesting because there was a study out of the Journal of Digestion, and they looked at all the people that they thought they have gluten sensitivity or celiac disease. 90% of the time, they were wrong. And that's why if you're going to go on this gluten-free diet, it's best to have the diagnosis first. And the way it works is you get a blood test and you can get a biopsy of your small intestine. The difference between this celiac disease is that you will basically, and the difference between celiac and insensitivity is that the GI system in celiac disease is affected, whereas with insensitivity, it's not. Bloating is the biggest symptoms. You have some food, you would get bloated, you have nausea, you have diarrhea, you have cramping, and you're self-diagnosing yourself. And once you go on this kind of diet, as you mentioned, they're going to become malnourished. They're not going to get all the nutrients, and it's not really good. Also, be careful that some of the multivitamins that they may have gluten, so be careful with that. And that's really important. It's everywhere. Processed food, ketchup, cereals, pasta, pizza, it's all over. But get tested before you just self-diagnose yourself and treat yourself.
Wow, so what do you do? I mean, you get the test?
It's overblown, Eric. That's the whole point of this. I really think it's overblown.
And I agree with that.
Overtreated.
It's the stuff in wheat and other grains that give it the stickiness, the elasticity. That's what it is. But these restaurants that are specializing in gluten-free, it's the big rage. Most people don't have it. The problem is if I test you, I can prove you don't have celiac disease. I cannot prove you don't have gluten.
That's very important.
I cannot prove. Now, you could try an elimination diet for a week or two, but people get carried away with this.
$6.2 billion by 2018. So it's a big market.
Yeah.
It's a big market and a big hype, in my opinion.
Okay.